Uganda, a nation rich in culture, resilience, and hope. Over the past 5 years, the United States Agency for International Development, USAID's Uganda Health System Strengthening Activity, UHSS, has worked tirelessly to enhance the health of Ugandans by strengthening the very systems that deliver care to millions.
As an activity, we were working to ensure that health system strengthening remains a key priority given the country's diverse health needs and the burden of communicable and non-communicable diseases. The key results areas focused on strengthening governance, leadership and accountability, health financing and public financial management, human resources for health, health information system, as well as community system at all levels of the health sector.
This was a collaborative effort. In partnership with government ministries, civil society, district local governments, and other stakeholders, UHSS provided targeted support in 77 districts, reaching public and private health sectors alike. The activity touched 135 districts and 11 cities in its human resources for health efforts and expanded its reach to an additional 59 districts under public financial management.
UHSS has supported us in a couple of areas. The first one with the improving and strengthening regional support supervision, working through regional referral hospitals. We work together to develop guidelines for that effect, to strengthen the structures we have there for improving quality of care in districts and urban authorities in their respective catchment areas for the regional referral hospitals.
We appreciate the USAID for the support they have rendered to the district at large and the community in improving the health services. There was a lot of absenteeism in facilities during that time when there was no supervision. But when that system came in place, it has helped that absenteeism has reduced at the workplace and work is going on.
The integrated human resource management system is critical for us in ensuring that information that we require in determining the human resources for health across the country at different levels of health service provided are available for planning and as well as accountability.
UHSS has been so helpful to the health sector for all the time. They have helped us to develop the schemes of service, and these schemes of service are very important. And they have helped us to develop the career progression for these cadres. So by having all this in place, they are motivated to do better because they know there is an opening in service.
It is a necessity to have the community health workers in our localities, most especially in Mayuge district. It has positively impacted so much in our health that in every parish we so far now have to choose who are almost working like the assistant health officers who are in their respective parishes. They are attached to health centers, and as Baitambogo we have 4 facilities.
Gaba USAID batutendeka okubanga tubane engeri gye tugemamu oba gye twogerezaganyamu n'abantu era nga tukubiriza abantu okubanga beetanira amalwaliro. Nga wano ku idwaliro twidde oluusi twayaganawo bamama banaabagemesa abaana twabawa omusomo nga tubasomesa birungi ki ebiri mu kugemesa omwana.
Strategic approaches such as capacity building, community engagement, advocacy for resources, and the digitalization of health systems were pivotal in achieving our objectives. The activity also intensified its focus on malaria control in 15 high-burden districts with support from the US President's Malaria Initiative.
So UHSS has supported us to reduce malaria in the district through many strategies, community dialogues, community sensitization meetings, involvement of religious leaders, political leaders, and now we are able to use our data.
We know what causes malaria. It is a mosquito. And you know the name of that mosquito? Female mosquito. Malaria kills. One of the prevention is we need to sleep under treated mosquito net.
The strengthening health systems activity has been critical in many aspects of health information management. Colleagues were part of the partners providing technical assistance in coming up with our health information and digital health strategy. They are a core component of our governance structure. They participate in the Health Information Innovation Research Technical Working Group, but they're also part of the different subcommittees that support the higher.
Nga twakayingira obwa VHT batusasulanga nga batuwa cash. Naye nga osooka ne mukola n'oddayo ne balyoka babayita ne mukomawo ne musayininga sente ezo ne bazibawa. Kaakati emyaka giringa 4 tusafuna sente ku masimu gaffe okusinziira ku kampeyini gye tuba tukoze oba omulimu gwe tuba tukoze. Sente zo ozifuna ku simu nga zezo ze bakugamba nga tewali zibatemyeko. So kati ffe ba VHT tuli basanyufu.
They have also been a key component in supporting our call center. They have supported the staff there, they have supported trainings, among others, to ensure that our call center, which is critical in both receiving feedback but also support calls that may come from our health workers.
We had these phones where I have to pick and then you return back. But when UHSS came, they provided us with soft phones. I think you can see some of the agents have the soft phones that they put here. And when a caller calls in, we just click on the computer, which we are also provided by UHSS, of course. So when we pick the call, we respond, and we follow up, and the patient or the person receives assistance that they needed. Revision of the structure for the health sector has been good because they had to do background research and ensured that now we need to streamline the operations of the Ministry of Health or to streamline the operations of the health sector.
Across the country, the impact of UHSS can be felt. Healthcare workers are better equipped, communities are more involved, and systems are more responsive. This is the legacy of UHSS, a stronger, more resilient health system for Uganda. The journey continues, but the foundation is strong. Together, we've built a healthier future for Uganda. Thank you, Uganda, for being part of this transformative journey. Funded by the American people through the United States Agency for International Development, USAID.